So my story is really more about finding that rabbit hole and digging into the rabbit hole. So when I was a hospital administrator, I was on the path of determining whether or not I wanted to be an entrepreneur. And in that process, I was just doing a lot of problem finding. So a lot of research, conversations, and a significant amount of reading. And when I came across, actually, it was more the fact that blockchain found me. So it was a recurring amount of email articles about blockchain technology. I found them through LinkedIn, I found them through Twitter, and it just started to seem to be that this technology had a lot of opportunity in all of the verticals of industries and across the world. And I started to see the opportunity specifically in how it can be used as a tool for efficiencies in healthcare. And as I continued to read and dive into learning about blockchain technology, which I learned about blockchain first and not crypto, when I started to learn about blockchain technology, I said, this is a massive opportunity, and I want to leverage blockchain as a tool in whatever we do as a company. My introduction to crypto was actually when Lucas and I competed in the Distributed Health Hackathon in October 2016. We were one of the winners, and the award was Bitcoin. And I was really angry that I got Bitcoin. I needed to pay back the cost that it was for me to get myself there, and then I paid for Lucas to be there as well. And it was living on savings, so I didn't have a lot of money. And I was like, I don't know what I'm supposed to do with this. Like, I have to repay the flights and everything that it cost me to get here. And Lucas was like, no. Here's what you want to do with this Bitcoin. Like, if you need to repay your flight, then go for it. But I highly recommend that you do this. And that was in October 2016. And in January 2017, he told me about Ether and Ethereum. And we made the decision to change Bitcoin into Ethereum. So that is my experience with blockchain and crypto. I've known about the technology and all the cool things that you can do with it, but really this idea around leveraging tokens and different token economies started to become much more apparent as you learn about cryptocurrencies. And of course, we're still in the extremely nascent phases of token economics until regulatory guidance and clearance has occurred all across the world. But there's a significant amount of really cool stuff that you can do with tokens and token economies. So public health is actually not something that I thought I was going to get into when I was in college. And the decision actually happened in the winter of my senior year in college, which is not a good time to decide to change majors. Most people change in freshman year. So I was doing clinical rotations in Ecuador. In December of 2006, I was in Quito, the capital of Ecuador, and was working in a maternity hospital there. It was a community hospital, public hospital. And then in January, I went to the rainforest of Ecuador. And throughout the whole process, it was fascinating and it was fun and it was very exciting, and all the rotations were in Spanish, so it was extra challenging. But what I started to realize is that there was a lot of repetition in that part of medicine that I saw, and that part of medicine that I thought I was interested in. And I saw a much more interesting opportunity and challenging opportunity around healthcare administration and looking at it from the lens of public health. So instead of, as a physician, one-on-one, you're working with a smaller denominator, I was interested in figuring out how to impact a much larger denominator, hundreds of thousands, millions of people, which you can do with public health. And so I started to learn about the field of public health as a senior in college, made the decision to not continue with the medical school process, and instead decided to get a master's of public health. So that is where it started. And I think I've just always had some sort of, public health and community focus since I was a kid. My mom and my grandmother were teachers, and my mom taught in a really underserved area of North Texas. SimplyVital Health started the idea for it started while I was a hospital administrator at Yale New Haven. And when I was there, it was about 6 months in, and I had moved really fast. Like I learned all of the tech tools really quickly, and eventually became the trainer for the department on the tech tools. and moved through my work really quickly and always just kept asking, what else can I do? What more is there? Where else can I go? What can I do? And it became pretty clear that hospital administration as a whole was probably a career that did not move as fast as my soul needed to move. And so I started to try to identify other areas of career opportunities where I could move really quickly. I personally, as a human, just really like to work. I've always been a really dedicated worker. I have a very high tolerance for grit and determination. And I kind of felt that the career as a hospital administrator wasn't going to fit that level of career desire that I wanted. And so when I started to identify other opportunities, being an entrepreneur really stood out. And I didn't have an idea in mind when I said, all right, I think I want to start something. And so I listened to podcasts. I read about, all of the big names, big companies that we know of. I learned about their stories. I've always loved studying successful people anyway. What's their background? How did they get to where they're going? And tried to model my career choices and degrees and all of that based on that. And so I just started problem finding and asking questions in healthcare. I started with an Excel spreadsheet with buttons and graphs and got a lot of no's and a few yeses, and was really able to identify what people in healthcare were willing to pay for. And I think that's one of the biggest things, and something that I talk about a lot. People who are starting healthcare ventures forget that there's a customer at the other end. And that customer, whether it's a physician or a hospital administrator or even a consumer, there's some sort of ROI that they're looking for. And I think that often gets left out in healthcare innovation, or even just application and software development, like what's someone actually going to pay for and buy. But the final decision after all of that research, the final decision was actually when I needed a specific platform and I couldn't find it, and I knew that it would help us in the department, the musculoskeletal department, and drive better outcomes. And after I wasn't able to find it, I said, this is it. I'm going to make the leap and create this platform. There are a couple of different ways that blockchain can help decrease the cost of healthcare. And that really is, I would say, the main focus of why we create blockchain tools that are safe for healthcare. And you can get pretty visionary in looking at different token economies and ways that you can leverage tokens for healthcare specifically, and using blockchain to drive efficiency. And if you can drive efficiency, that can help decrease the cost of healthcare, which should, one would argue, be passed down to the patient. Now, there's a lot of healthcare is very complicated. And that's why I really like meeting entrepreneurs that are innovating in healthcare that came from healthcare, just because there is a lot to know about healthcare, how healthcare works. So, for example, a lot of the reason why data is inaccessible or doesn't move in healthcare is not because there is not a technological way to do it. It's actually because there's no business incentive to move that data around. So a big inefficiency in healthcare, which drives up the cost, is, say, for example, a health insurance company having to wait a really long time to get access to data and then running their analyses and paying claims based on that. But what could be done if we were able to give them access to data in near real time? They could process claims faster, the patient could get paid faster, you could reduce a lot of overhead and administration. One could argue that that should decrease the cost of healthcare. One could argue that it might not also, because they're for-profit entities usually. But you can see that there are a lot of insurance companies that are dedicated to decreasing the cost of care. You would hope that that would get passed on to the patient. But the other thing, though, is with blockchain, you can create new insurance models. So one of the big ones that we focus on are bundled payments, which essentially is just like a certain amount of money for a procedure. And not all procedures and diagnoses are good for bundled payments. There are some that are better than others. But basically what you can do is you can bring everybody together in one place that's supporting that patient and have the same access to data. And use blockchain in some really cool ways. One is for an audit trail, so you know where the patient went, what care they received. The audit trail helps for reimbursement. You can also we have a key pair system and the key pair system governs access to data. So that can allow all of the different parties to have certain access to data that helps them make their decisions faster. And so you can create really cool and new models. And I think that's what is the most exciting about blockchain technology is we're kind of in the phase right now where everybody's trying to take the technology and fit it into existing systems. But I think what's really going to be the most impactful is when, especially in healthcare, when we start to see blockchain technology being applied to creating completely new systems. And I think that's where a lot of our focus is in terms of research and development and future thinking, because you can see a lot of benefit from that in terms of decreasing the cost of healthcare. Basically, what we identified is that, or we hypothesized and tested that we thought that blockchain technology or healthcare needed a blockchain that was safely adaptable. And basically what we mean by that is the Bitcoin and Ethereum protocols are great and have a very specific level of security, but that security is not something that healthcare feels comfortable with or is familiar with. And what I mean by that is that the nodes in Bitcoin and Ethereum are unidentifiable. So what we did instead is because we really like the Ethereum protocol and believe in how, where it is today, it's highly tested. There are a lot of developers that use the Ethereum protocol. We're a fork of Ethereum, but we do have our own consortium and governance, which we believe is important because healthcare, we think long-term healthcare will benefit more from a public permissioned blockchain. So public meaning it's Ethereum, and it's not just a network between like 5 computers, it's global. And then permissioned meaning that anyone that runs a node goes through a certain level of KYC, so know your customer, so you actually know the human that's running it or the entity that's running it. And secondly, and perhaps most important for healthcare, is that the computer or server has to have a certain level of HIPAA compliance. And we chose HIPAA for one main reason, which is that it's globally identifiable as a security protocol. And I'll get back to what that means to an application in a second, because it's actually different. But at least everybody knows that, like, I've heard of HIPAA. I know that that's a security regulation. I know that this node adheres to a different level of a protocol. And then the other thing about HIPAA is that it's a spectrum. In that, so we as a healthcare company with our proprietary software only have to check mark a certain part of HIPAA compliance to follow HIPAA guidelines to be compliant. But a larger company, say United Health Group, has a lot more requirements that they have to hit in order to be compliant. And so when we were looking at the opportunity for the consortium, we wanted to strike a good balance for what made sense for nodes. So that's why we call it healthcare safe. So this would be my personal opinion. It's just based on working in healthcare. So I think that there is a lot of opportunity for health insurance reform. And what I mean by that is just finding new models and new opportunities that really focus on putting the patient at the center. In healthcare in the United States, we've kind of pulled away from the fact, I mean, there's like no customer service in healthcare. And there are a lot of efforts to change that. And when I was working as a hospital administrator, we were very, very focused on first recognizing that there has been a decline in customer service in healthcare, and then identifying ways to improve it. Now, one of the things that's really, really, really important to remember about healthcare is that healthcare doesn't move at the pace of consumer apps. So there are a lot of changes that are happening both at the federal level and at our hospitals and physician practices that may be hard to see on a macro, like a macro scale, a much larger scale. One of the things that I think is actually really good as a patient myself, it was difficult as a hospital administrator, but as a patient, in the United States, hospitals are actually judged on their patient satisfaction. And if a patient is dissatisfied and they're there's a consistent pattern of patient dissatisfaction, that can actually financially impact a hospital, where they will receive penalties for having a lower patient satisfaction. And this data is actually becoming public. So you can, through Medicare and Medicaid, which is the public health insurance system in the United States, you can actually go on and see the patient satisfaction scores across different hospitals. So I think the biggest opportunity for healthcare in the US is patient satisfaction. And kind of approaching it as customer service. And I know a lot of people kind of cringe when you say the word customer and healthcare together. But if you really think about some of the best experiences that you've ever had, why would that be? Like, why can't you say customer satisfaction and customer service in healthcare? Because I would love to have some of those similar experiences in a hospital setting or a physician setting. So I would say that's the largest opportunity. In terms of how blockchain technology can help with that, a lot of conversations that we have is really around data access. So accessing that data both on the patient side and provider side to be able to make decisions much more efficiently, effectively, and decrease the cost. So we talk about, I'm sure you've heard about the opioid crisis that we have here in the US, not uncommon across the world, but I think it's pretty strong in the US. One thing that you can use blockchain for, and we actually have a couple of entrepreneurs that are in different stages of development using Health Nexus for these issues, is you can track which pharmacies or which patients or which doctors are prescribing and getting opioids. And you can track and trend that over time. You can track it over state or within the state. There are some laws that you have to follow in terms of going state to state, but we have entrepreneurs that are specifically focused in making sure that people are following the right guidelines for opioid prescriptions. The biggest challenge right now is general regulatory uncertainty. And I think that it's a new technology. So understandably, everybody is trying to figure it out and find ways to regulate certain parts of it, and which completely makes sense. And so I think once that certainty has occurred, I think that will help the industry worldwide move forward. So I think that's the biggest thing right now, is that everybody's just trying to figure it out, which again is not uncommon to any new vertical or new innovation that happened with the internet. It happened with Google with their advertising ways. It's happened to ride sharing, which we've already talked about, and it's happened to companies like Airbnb. So it's just part of the process. But I would say that that's the largest thing that we're seeing and hearing in the community among our colleagues and friends. The second thing I would say is actually education. So education specifically in healthcare about how you can use blockchain as a tool. I think people can recite some sort of definition of what blockchain technology is, but in terms of identifying opportunities to use it as a tool and drive efficiency is kind of the next step in where we are as an industry. Once we get beyond that and people start to realize that there are a lot of opportunities and there are certain situations that aren't good for blockchain, we can continue to move forward. And so right now we actually spend a lot of our time on education. So that's either through our education course that we have on Udemy, which is looking at blockchain in healthcare. It's through consulting. So we do consulting in various roles, either in healthcare or on the blockchain side, or even with specific development of the blockchain application. And we've noticed that helps things get moving a little bit faster too. So I think it really depends on what the physician or clinician is interested in doing. If they're interested in becoming an entrepreneur, then leveraging blockchain as a tool or figuring out how to develop blockchain technologies would be a really great idea. But in terms of clinicians just using an application that has blockchain in it or uses blockchain as a tool, I actually don't think it's important for them to know. And sometimes it's just, sometimes they just don't need to know. Like, we don't need to know that, I don't know, Zoom may use AWS as their cloud-based server, or maybe they have an on-prem server. I don't know. All I care about is that the application actually works when I need it to work. So I think it's more around making sure that the application delivers a very specific level of value for the clinician that would be using it. I don't think it's necessary that they understand blockchain technology or how to code blockchain unless they're actually interested in becoming an entrepreneur or starting a company themselves. More of a practical experience of what I've seen in the space, which is I do still think that there are more men than women in blockchain technology, but I still hold to the truth that I think that the gap is narrowing. I think that we have more women in blockchain technology than any other previous innovation in technology. Now, I don't think that has anything to do with blockchain itself. I think that has more to do with all of the work that women have done previously to get us to this point. And I think as we continue to move forward in technology, we'll start to see narrower and narrower gaps between gender, race, and ethnicity. And I think it's not technology specific. I think it's more of just the combined efforts of everyone in the history and in the past. There's a lot of opportunity for innovation in healthcare and ways that blockchain can be used as a tool. I think a lot of people just go straight to data access just because it's highly recognized as an important need. But there are a lot of different opportunities. So we talked previously about insurance reform, which still does focus around data access. But you can also do some really cool funding models with different ways to if the parties had access to data in certain ways, you may be able to move insurance claims a little bit faster and then be able to do funding models earlier. So just by using blockchain as a tool for that. And I think administratively, a lot of conversation has been had around using blockchain for making sure that everybody's on the same page instead of using different data points. So I think that there are a lot of other opportunities for healthcare specifically, but I will have to say that my perspective, a lot of them come down to data access. So there still is that data component around efficiency in healthcare. What I would say is just be ready for the time that it's going to take to develop this industry. We're very used to technological advancement moving really quickly, and it takes time to build something completely new and innovative. And so I would just ask that if there's anybody coming into the space as an entrepreneur or aspiring entrepreneur, just give yourself time to create something that's really fantastic and don't try to rush it. And I think that that's a pretty standard perspective to have as an entrepreneur anyway, and to not lose sight of that just because it's blockchain technology and it's really cool. And then the other thing that I would say is stay grounded in the perspective of why you think blockchain technology makes sense. There's a lot of hype around blockchain, just like there's a lot of hype around AI, and there's a lot of hype around just new technology in general. And just making sure that when you're looking at new technology and new innovations, that you understand what the true uses are, where the boundaries are, and just stay grounded and focused on why you're using that particular innovation.